Hello and welcome. This presentation is titled Parents in the Know, Understanding Youth Resources for Developmental Disabilities, Mental Health, and Substance Use Disorders. The Suffolk County Prevention Workgroup put this presentation together to provide families and caregivers with contact information for local agencies that can provide free or low-cost parent education and support, and help you with next steps in getting your child the support that they need to thrive. The Suffolk County Prevention Workgroup focuses on prevention issues in Suffolk County and ways to overcome barriers and make overall improvements to behavioral health as a community. This presentation is about prevention and where parents and caregivers can begin if they have a concern about their child with regards to developmental delays or disabilities, mental health, and/or substance use. This presentation will discuss what to look for and how to access services and supports if you believe your child is experiencing a developmental delay, requiring more help in school, is showing signs of struggling emotionally, and/or experimenting with alcohol or other drugs. There are many other resources out there to help you, and we want to give you as much information as possible to be the best advocate for your child. At the end of the presentation, information will be given on how to access a resource guide that lists all the resources mentioned in this presentation. Prevention is the promotion of overall wellness in individuals, families, and the community. Public health prevention efforts aim to support the health and well-being of people by preventing problems before they start or can progress to an unhealthy result. It is a proactive process that uses effective strategies and programs to reduce and/or prevent substance use. Prevention efforts can reduce the impact of developmental disabilities and mental health challenges. Prevention empowers individuals and systems to meet the challenges of life events and transitions. It creates and reinforces conditions that promote healthy behaviors and lifestyles. But prevention is more than just that. Most public health prevention efforts work by supporting health and well-being, not just preventing problems. Prevention leads to happier, healthier, more connected individuals and communities. This presentation will be divided into 3 topics: developmental disabilities, mental health, and substance use. Part 1. Developmental disabilities. Developmental disabilities are a group of conditions that result from impairment in physical, cognitive, language, or behavior areas. These conditions usually begin during the developmental period, and they may impact day-to-day functioning. Developmental disabilities usually last throughout a person's lifetime. Child development describes how children grow and change. Experts divide developmental stages into 5 periods from birth to 18 years old. At each stage, healthcare providers expect children to meet certain developmental milestones. Identifying and knowing the cause of delays can help you find the right supports. Developmental disabilities occur among all racial, gender, ethnic, and socioeconomic groups. According to the Centers for Disease Control and Prevention, the CDC, about 17% of children aged 3 to 17 years of age have 1 or more developmental disabilities. That is 1 in every 6 children in the United States. Additionally, about 3% of newborns in the United States are born with conditions related to problems in prenatal development. That is 1 in every 33 newborns in the United States. Let's talk about risk factors for developmental disabilities. Risk factors are characteristics at the biological, psychological, family, community, or cultural level that are linked with a higher likelihood of negative outcomes. Risk factors for developmental disabilities include genetics, complications during birth, infections the mother might have during pregnancy or the baby might have early in life, exposure of the mother or child to high levels of environmental toxins, such as lead, and parental health and behaviors during pregnancy. Most disabilities are thought to be caused by a complex mix of factors. Most developmental disabilities begin before a baby is born, but some can happen after birth because of injury, infection, or other factors. Next, we'll discuss signs and symptoms, or what to look for in your child if you suspect a developmental delay or disability. From birth to 5 years, your child should reach certain milestones in how he or she plays, learns, speaks, acts, and moves. Young children learn and develop differently. One child might walk earlier than another, while another child might talk first. Usually, over time, these differences will even out. You can track your child's development and act early if you have a concern. Tracking your child's milestones gives you the chance to catch early signs of possible developmental problems. This gives your child the best chance to get the help he or she might need. The CDC has a milestone tracker app that parents or caregivers can download to help track milestones. Go to www.cdc.gov/milestone tracker to download the app. Lastly, you should talk with your baby's or child's doctor at every well-child visit about the milestones your baby or child has reached and what to expect next. If you have concerns about your child's development, the earlier you get help, the better. So what can a parent or caregiver do? If your baby or child is not meeting one or more milestones, has lost skills he or she once had, or you have other concerns, act early. Talk openly with your child's doctor about your concerns, ask for parent resources and support, and talk to your child's teachers. Early help makes a difference. It may put your mind at ease to talk to someone. Talk with your doctor or call your local early intervention program. Suffolk County has an early intervention program, and their program referral line is 631-853-3100. You can also call Growing Up Healthy 24-hour hotline at 1-800-522-5006. Or you can call the Center for Disease Control's hotline at 1-800-CDC-INFO, which is 1-800-232-4636. There are several resources that families and caregivers can access if you have concerns about your child's development. Here is a list of national, state, and local resources for families and caregivers to access. These resources are in the resource guide to this presentation, which can be accessed through the SuffolkStopAddiction.org website. Part 2, Mental Health. Our next topic covers information about children's mental health. According to the Center for Disease Control and Prevention, 1 in 6 U.S. youth aged 6 to 17 experience a mental health disorder each year. These numbers seem to be increasing. From 2016 to 2020, prior to COVID, the percentage of children who had anxiety or depression in New York grew by 25%, from 8.9% in 2016 to 10.9% in 2020. Students aged 6 to 17 with mental, emotional, or behavioral concerns are 3 times more likely to repeat a grade. Additionally, death by suicide has risen to become the second leading cause of death for individuals aged 10 to 34 in our state. This seems to be affecting young women and the LGBTQIA+ community more. Nationally, emergency department visits for suicide attempts were higher during COVID when compared to before the pandemic. For adolescent girls, emergency department visits for suicide attempts were 51% greater. For boys, emergency department visits for suicide attempts were 3.7% greater. Additionally, American Indians have the highest suicide rate of any ethnic group. By providing families and caregivers with this prevention information, we hope that children with mental health challenges can receive early support. Early support can prevent negative outcomes like hospitalization and loss of education time. It can also prevent increased financial stress on the family system from job loss or job instability for parents. According to research from the National Institute of Mental Health, mental illness is usually caused by a combination of these main factors: biological, psychological, familial, and community and cultural factors. It's helpful for parents and caregivers to be aware of risk factors linked to the start of a mental illness. Understanding risks can help a caregiver figure out that a child needs more help. These are also worth sharing with professionals working with your child. The first category of risk factors we'll describe are biological factors, like family genes. If an immediate family member, like a parent, grandparent, sibling, or child, lives with a mental health diagnosis, children in that family may share that gene. On its own, this is not a guarantee that a child will have a mental illness. But family history is something to share with your pediatrician if you become worried about your child's behavior. Other examples of biological factors are parental alcohol or substance use, infections, exposure to toxins, brain defects or injuries, and developmental disabilities. The second category of risk factors we will describe are psychological factors, which are personality traits, thoughts, emotions, and attitudes. They can include difficult temperament, low self-esteem, anxious or insecure attachment, and poor social skills. These risk factors may lead the child to have a poor self-image. They may develop negative thinking, isolate themselves, or believe they are incompetent. Youth affected by these psychological factors may benefit from ongoing support in school and at home. The third category of risk factors for mental illness is familial factors. These are factors related to home or family life, which can have an effect on a child's emotional health. Some examples of family factors include homelessness, food insecurity, neglect, domestic or community violence, or emotional abuse. Another familial factor could be a stressful or traumatic life event. For instance, in the wake of COVID, many families lost a beloved family member. Ongoing bullying, rejection by peers, or a parent's divorce are also traumatic events. The fourth and final risk factor for mental illness are cultural and community factors. Some examples of cultural and community factors include discrimination, such as being LGBTQIA+ in an unaccepting home or community environment, or being a member of a racial or ethnic minority. What we can see here is that many different types of factors can impact the emotional health of a child. It's important to keep in mind that having risk factors does not guarantee a child will have or develop a mental health condition. Identifying risk factors is a tool that can be helpful in monitoring your child's mental health. They can help a caregiver be proactive in addressing emotional issues so they do not get worse. Next, we'll discuss some signs that your child might need more support to address a behavioral health challenge. Remember, acting early, or what's called early intervention, can make a big difference in improving a child's emotional well-being. It can also slow or stop the progression of mental health symptoms. So let's review some signs and symptoms to look for. The first symptom to look for is frequent physical complaints, stomach aches, body pain, fatigue, or rapid heartbeat. These complaints can lead to more visits to the school nurse and more absences from school or from activities youth enjoyed. A physical symptom should be ruled out by your pediatrician before assuming that this is an emotional issue. A child consistently telling you they don't feel well needs to be taken seriously. Another symptom is severe worry or anxiety. This includes refusing to go to school, go to sleep, or take part in age-appropriate activities or socializing. Again, medical conditions should be ruled out first before looking at other causes. It can be helpful to track these episodes on a calendar in order to find any patterns. Withdrawal can be another sign that your child might need more support. It is important to note that if they are avoiding activities that they used to enjoy. If you notice that a child is staying in their room and becoming mad or frustrated with attempts to engage them, you should discuss this behavior with the child, their school, and with their doctor. Examples of this behavior include extreme mood swings or oppositional resistant behavior, marked changes in sleeping, eating, dressing habits, or school performance, extreme difficulties in concentration that get in the way at school or home, sexual acting out or age-inappropriate sexually charged behavior, a change in friend group. Friend groups have significant influence and are reflective of where your child is psychologically, emotionally, and socially. Use of drugs or alcohol, missing money, and/or missing prescription medication. In the teen years, most children experience periods when they can become moody, sleep more, or begin to experiment with risk and their personal identities. What's important for parents or caregivers to think about and to communicate to professionals is the degree to which these changes are impacting your child's life and the degree of any change you witness. Again, it can be beneficial to track these issues on your personal calendar. When you bring concerns to a school or medical professional, you can discuss concrete examples during the appointment. Now that we've discussed risk factors and signs and symptoms of mental illness, let's discuss next steps. What should you do if you're concerned about a child's mental health? You can talk with your pediatrician to rule out physical or medical conditions. Request medical referrals for evaluations if you think they're needed. While you are creating these supports for your child, continue to pay attention to your child's behaviors and friend group, and look for any noticeable changes. Keep the lines of communication open. Talk, they hear you. Talk to your child about any concerns that you have, but also remember to listen. Once our children reach adolescence, they benefit from being seen as authorities on their health and identities. Educate yourself. Find the parent support groups that offer free or reduced cost parent education and parent support. Parent education classes can provide you with a support network and communication strategies to use with your child. These strategies can reduce stress at home. Many parents find it helpful to receive support from family peer advocates. Family peer advocates are credentialed professionals who have lived experience as primary caregivers for children with social, emotional, or behavioral challenges. Lastly, talk with your child's teacher to discuss concerns. Document anything said verbally and writing in a follow-up email. You can also request a group meeting in writing if you believe that your child requires extra accommodations to thrive in school. Include your child's teacher as well as the school's psychologist or social worker in the team meeting. Ask for an individualized education plan, an IEP, or a 504 plan if you think that your child has a diagnosis that is stopping them from receiving a free and appropriate public education in the least restrictive environment. Some resources to educate caregivers about special education policies are at the end of this presentation. Great sources of information about policies and supports in your district can be your Parent-Teacher Association, the PTA, or Special Education Parent-Teacher Association, or SEPTA. The following is a list of mental health resources. They can also be accessed through the Suffolk StopAddiction.org website. If it is an emergency or your child is in crisis, call 988, the Suicide and Crisis Lifeline. 988 provides 24/7 free and confidential support to people in suicidal crisis or emotional distress. It can also be used as a resource by concerned caregivers. You can access support either by calling or texting 988. If you have immediate concerns that your loved one will harm themselves or someone else, it is best to contact 911 and utilize the Comprehensive Psychiatric Emergency Program, CPEP, at Stony Brook Hospital. The Diagnostic Assessment and Stabilization Hub, known as DASH, can also be contacted at 631-952-3333, 24/7, and a mobile response team of licensed professional experts will come to you in the community and conduct an assessment and make recommendations. If this is not an emergency, here are 2 local resources to access. 1. Suffolk County Children's Single Point of Access, or CSPOA, coordinates enhanced mental health services for youth who are at risk or have been diagnosed with a serious emotional disturbance and their families. The CSPOA offers a centralized, coordinated referral process to ensure appropriate service delivery to the highest needs youth, including community-based and residential programs. All CSPOA programs are voluntary for both the youth and their family. Call 631-853-8513 for more information. 2. Family Service League's DASH Center can also be utilized as a walk-in, and no appointment is needed for assessments, counseling, and intervention for children 5 years or older, adolescents, and adults. DASH offers 24-hour, 7 days a week, year-round crisis care at a community-based site. The program is available to Suffolk residents who struggle with mental health and substance use disorders. DASH is located at 90 Adams Avenue in Hauppauge. The hotline number is 631-952-3333. Additional resources include Families Together in New York State, which is a family-run organization that represents families of children with social, emotional, behavioral, and cross-systems challenges. Their goal is to ensure that all children and youth have the support they need in order to succeed. The toll-free information and referral line provides technical assistance to families, advocates, service providers, and policymakers. Call 1-888-326-8644 to reach an information and referral specialist. National Alliance on Mental Health, or NAMI, is an organization of families, friends, and individuals whose lives have been affected by mental illness. Together, they advocate for better lives for those individuals. Go to NAMICSLINY.org for more information about free programs on Long Island, or call the NAMI National Helpline at 800-950-NAMI. Part 3, Substance Use. Our final topic covers information about substance use. Here are some statistics about substance use that affect our youth today. The Food and Drug Administration reported that in 2023, more than 2.8 million U.S. middle and high school students used e-cigarettes in the past 30 days. That is 1 in every 10 students. According to the National Institute of Health, an estimated 894,000 adolescents aged 12 to 17 had an alcohol use disorder in 2021. Cannabis, or THC, is harmful to growing brains and may cause long-term health and social impacts. The prefrontal cortex is the last part of the brain to develop. This part of the brain helps us make critical decisions and is linked to memory, attention, and judgment. Cannabis use has a negative impact on this part of the brain. Studies show that substance use can begin as early as 12 years of age or younger, which is why having knowledge of risk factors is crucial. As discussed, Risk factors can include biological, psychological, familial, community, or cultural factors. Having a family history of substance use and/or having a parent with substance use disorder can increase a child's risk. Genetic predisposition puts children at a higher risk of developing a substance use disorder. Another risk factor is parental attitudes. If their parent has a positive attitude toward substance use among children is higher. Children observe behaviors of their parents and their caregivers, and they can often imitate those behaviors. Parental monitoring plays an important role in healthy adolescent development. Know where your child is, who their friends are, and what activities they're participating in. Supervise or exercise some control over their activities, like setting curfews. Poor parental monitoring gives your child more chances to access and experiment with substances. Parents and caregivers should also check the social media sites children use, see what they're watching. Children can be influenced by what they see. Family rejection of sexual orientation or gender identity is another risk factor. Being a member of the LGBTQIA+ community increases a child's risk for a substance use disorder. In a 2008 study, the odds of substance abuse in LGBTQIA+ teens was 190% higher than for heterosexual youth. Another risk factor can be peer pressure. It is one of the biggest challenges a child faces. They may feel the pressure to engage in using substances to be part of a group. Peer social norms can also influence a child's behavior. If your child sees their peers using a substance often, they may feel the social pressure to do so, even if they aren't directly being peer pressured. Not enough family bonding or school connectedness can be a risk factor. Poor social skills, poor problem-solving skills, and fewer critical thinking skills can also increase the risk of substance use. A stressful or traumatic life event can cause a child to look for a way to make the pain stop or try to forget about their experience. To stop the pain or forget, they may use substances, including prescription medications. These risk factors do not mean that your child will develop a substance use disorder, but it can put them at a higher risk of experimenting. It's important to be a proactive parent to prevent your child from using substances. Let's look at some of the signs and symptoms of substance use. Parents and caregivers are familiar with the typical behaviors of their child. A child will go through changes as they get older, but there are signs and symptoms to look for that may point to substance use. Looking at their behavior, you may notice changes in moods, like being withdrawn, angry, deceitful, or unmotivated. They may lie, steal, frequently ask for money, hide their phones, lock their bedroom doors, and disappear for long periods of time. There may be changes in relationships with family and friends. Your child may start spending time with a different group of friends and ignore invitations from their former friend groups. They may have lost interest in hobbies or activities. Their grades may be slipping, or they may be withdrawing from school activities or class participation. Some physical signs may be a lack of coordination, poor balance, stumbling around and being clumsy. Other physical health signs include nosebleeds, runny nose not caused by colds or allergies, frequent sweating, sudden or dramatic weight loss or gain, and skin abrasions or bruises. You may notice a change in their sleep patterns. This can look like times of high energy and not sleeping, which is then followed by long periods of catch-up sleep. They may have glazed or bloodshot eyes, or their pupils may be larger or smaller than usual. Your child may not be the kind to shower every day or wear clean clothes, but you may notice personal hygiene changes or a change in their appearance. Notice how your child is dressing. Are they wearing clothing to cover their arms and legs or hide marks? Are they wearing long sleeves or turtleneck sweaters in the summer? This could be to cover up needle marks, also called track marks. Other signs of substance use can include red or flushed cheeks, burns or marks on fingers or lips, or smelling like smoke or other unusual smells. Let's discuss what you can do if you think your child may be using drugs. Pay attention to your child's behaviors. It is helpful to document when these behaviors and changes happen and how often. It's helpful to note when the changes started. Speak with your child's doctor about your concerns so they can rule out any physical or medical conditions. Find out about the friends that your child is spending time with. Social media may be helpful in seeing what type of activities they may be involved with. Look your child in the eyes and be direct when asking what is going on. Make sure to listen to them as well. Parents like to respect their child's privacy, but it is important to search their spaces when substance use is suspected. Talk to your child. Most times, parents and caregivers assume that their child is not listening, but they do hear you. Discuss your concerns with your child. Do not accuse them, as they may become defensive and then shut down. Get educated and learn about the resources that are available to you and your child. Talk to your child's teachers about how they're doing in school and any changes of behavior. You can share your concerns about their behavior there. You can also find out what services are available for your child in their school. Seek out information from teachers, social workers, and school psychologists. Most school districts have substance use counselors available, or they can provide you with a referral list. And importantly, seek professional help. Speak with your child's doctor and request referrals. The following is a list of substance use resources. These resources and others can be accessed through SuffolkStopAddiction.org. The Suffolk Stop Addiction website is managed by the Suffolk County Department of Health. It features local harm reduction, prevention, treatment, services available in Suffolk County. The three main educational and resource areas on the website are substance use, mental health, and problem gambling. The website also has the latest Suffolk County Directory of Behavioral Health Services guide. Another resource to highlight is Long Island Addiction Resource Center. The website can be found at longislandaddictionresourcecenter.org. This website provides easy-to-use access to invaluable information about providers of education, prevention, treatment, recovery, and peer services. This website is for everyone, from community members to substance use disorder and problem gambling field professionals. Another resource is the Talk to Prevent Parent Toolkit, provided by the New York State Office of Addiction Services and Supports. This toolkit has informational pamphlets and guides for practicing prevention at home. It provides educational materials and conversation starters to lead meaningful conversations about substance use, gambling, and addiction. The toolkit can be found at www.talktoprevent.ny.gov. The information we've provided is to help you, parents, caregivers, be proactive and take the first steps in accessing supports and services for your child. Know that you're not alone in this process, and there are many resources to guide you through this journey. Resources can be found at SuffolkStopAddiction.org. Remember, prevention efforts work by supporting health and well-being, not just preventing problems.